Question 31. When evacuating patients during a fire, you should never use the A. hallways, B. elevator, C. stairwell, D. windows. Answer B. Explanation. Never use an elevator when there is a fire. The fire can destroy the electrical circuits, which could trap you and the patients. Elevator shafts also can act as a chimney, filling quickly with smoke. Also, your exit will be delayed by stopping at every floor since others will press the button. Question 32. If a resident is vomiting in bed, position them immediately in the A. lateral position, B. sitting position, C. supine position, D. prone position. Answer B. Explanation. Sitting is the best way to prevent aspiration. The contents of the stomach have less of a chance to enter the lungs when the resident is in an upright position. Question 33. When a patient who has been dizzy is showering, you should A. Take care of the patient's roommate while the patient showers. B. Sit the patient in a shower chair and remain nearby. C. Start another patient's shower to save time. D. Get the patient started, then leave to respect privacy. Answer B. Explanation. Showers or bath present a risk for falls. If there is any doubt about a patient's ability to maintain balance, use a shower chair. Sitting in a chair lets the patient be safe while enjoying the warm spray. Before having the patient sit, make sure the shower chair is clean and sturdy. The patient's feet should be able to touch the floor. Question 34. A patient's call line should always be A. on the wall, B. pinned to the clothing, C. within reach, D. clipped to the bed. Answer C. Explanation. After giving care or when leaving the patient's room, always ensure that the patient's call signal is within reach. Patients must always have access to caregivers. For safety, bed should be in the lowest position. Question 35. Safety measures to prevent accidental poisoning from medications include A. Call medication candy, so patients will be more likely to take it. B. Transfer medications to other containers. C. Give medication in the dark to avoid waking the patient. D. Never leave medicine out where it can be swallowed. Answer D. Explanation. Accidental poisoning from medications can be prevented, especially among children who are at the highest risk. Medications are the leading reason for poisoning in children. About 95% of medication-related poisoning among children happens when medication is available and children are unsupervised. All adults are responsible for storing and dispensing medication safely. Always use child-proof stops and keep medications in their original containers. Don't take medications in front of children who like to mimic adults. Never call medicine candy. When taking medications during the night, turn on the line to ensure the proper drug and dosage is being taken. Question 36. Factors that increase a resident's risk of falling include A. Sensory problems, B. Medication use, C. Muscle weakness, D. All of the above. Answer D. Explanation. As people age, their physical and medical conditions can lead to increased risks for falling. Muscle weakness, especially in the legs, is one of the most important risk factors. Medications and the side effects can cause dizziness or confusion. Sensory problems such as numbness in the feet or foot pain increase the risk of falls. Other risk factors include poor vision, balance problems, and slow reflexes. Question 37. The most common cause of accidents in the home results from A. Falls, B. Lacerations, C. Abrasions, D. Burns. Answer A. Explanation. According to the National Safety Council, falls are the number one cause of home accidents. For age 65 and older, falls are the first cause of injury-related death, including broken hips. Many falls can be prevented with simple measures such as removing small drugs and clutter and wiping up spills. Question 38. A resident who is resting in bed suddenly complains of shortness of breath. What should you do? A. Raise the resident's feet. B. Monitor the resident's vital signs. C. Elevate the head of the bed. D. Tell the resident to take deep breaths. Answer C. Explanation. When a client is having difficulty breathing, Fowler's position can provide relief. When sitting in Fowler's position, the client upright at 90 degrees, allowing the chest to expand as much as possible. Prone on the abdomen, supine on the back, and lateral on the side are all flat positions, which can make respiratory distress worse. Question 39. Vomiting can be dangerous because of the possibility of A. Aspiration, B. Hypertension, C. Stroke, D. Infarct. Answer A. Explanation. Vomit is the contents of the stomach. It is very acidic, which can be dangerous to the lungs if it gets inhaled. Usually the cough reflex keeps anything from entering the lungs, but if a patient is weak, sedated, or elderly, the cough reflex may not be effective. If vomit gets aspirated into the lungs, it can cause choking or pneumonia, which are both life-threatening. Question 40. While assisting a resident with walking, the resident becomes faint and begins to fall. The nurse aide should A. Ease the resident to the floor and call for help. B. Hold the resident up and call for help. C. Hold the resident up and continue walking. D. Carry the resident back to bed and then go for help. Answer A. Explanation. If the resident begins to fall while walking or standing, do not try to catch them or prevent the fall. Call for help. Control the fall by easing them to the floor. This prevents injury to both the resident and the nurse aide. It also allows you to protect the resident's head from hitting the floor or an object. Stay with the resident until help arrives. Thank you for watching.